No me no apemu pepepe Mpom Te Sen. Oh na ho te say bread we see afia ho adwen wa pomuden mum eno nti ya ba pa na me no abo mpuni mpu ya tame awuya ezebe ye bode nyame ngu na mewuye hruye ye osi achechede akire kwa Eradi wo mu abibia ya kama Ebredu si ehia fe ho adwen e wa pomuden pa kwan so bosome nyina maka tro se ye hwe ma ya won sensem no na yetimi atase ne ma ne bi yie na dia asomdwe ma pa bre ye we dada brabo manu ana ne bredura enu ntima gye adwa de bro na hwe etoda enipa bi e wo wakwan mu a wo fi so mo do pa wo fi so mo no tiye pa oh wo feel say enye de omde boa wo mpo a banu so a emia enti wo so wo be so wo mu bi se wo mo ehunu ne ye na wo mo me pesa me use word bi wo mo ehunu we ye no mo ye niam anwonran na enu achi wo mo ati buabu wonfo na wo dane wo ho a eye sususu ho if it's a bia na nyame abo kokwa se asomasi pamne firi ho asomasi mane firi wakwem asomasi monko ena watwi wani ena wonyeye eti nyankopon fa sa wo mo asuban so na wo de yi wo mo firi ho obehu so mo firi ho a na nhira bebredi wachi eno no ye friend blessings sometimes in disguise eti tebia na wonam mu enne no emane hawo enipa bi ewo so mo firi wakwem na wonya bre time is expensive ema wo ho ne wo nkoso and the people who matters ebi mo ho no mo ho eni brefo ono namo emwa ebe say wo ebe waste time ema wo ndru obotaye no ho se wa mpam wo mpo na omo aye say bi nti kwa ensu ho me say most ya na blessings in disguise Erade kasa kire ye nti okana wonti ana ono an kasa atabiriwo efrisa nipa no fidi sumfo no na fidiem sa otaye no na wayi wafrim na watimi akoanim etitibia biara whatever your lot say it is well with my soul eti de na wonam mu no de na we mu ye petepete ye hwirihwiri oh ignore your biggest tool. Now focus. Emaunya time for yourself. Time for the necessary things and things of God. Focus. Ubedim konem. Medasi. Me wo APC freaking farmer stubborn pain be kono ade ho drone freaking farmer tried and tested no be ebe ye unshira happy delight fruit juice ye load with taste enu abemu nsuo krogin no ne de aye ewo convenience store say try ho hye nyina enwume adaroma ene age adwa edi Mpom Te Sen eba me na o masemra ye ba me try me bie phone lines na ma wansa ene ne doctor kasa me ba
said you bet me a check in a farmer APC in Sunti and why yen sakuma
uti paiwa
fucking a farmer akuma APC
kaka hawa
akuma APC
sisiare wa posunu no mpemu na ya oya fever ana wona me ya
emu bia kina farmer akuma APC ebe ye firi ho nemum na nuachi na enkoy dia ko hu doctor kina farmer akuma APC eyema obia ya wadi emfie dunsia 16 years dekro
Happy Delight Fruit Juice. Swachilala, chichi soso. Afrana pa. Epe kwashu breakfast and was in woman. Joe Happy Delight Fruit Juice. Against with toast, cereal, and even them cool. And we ain't a bread and fifi. Most of free man. Happy Delight Fruit Juice. One of what? And you be here. Come out to relax anyway. So I know when you're. Let's say what a chamado. Happy Delight Fruit Juice. Off and a baby, I bring you all day long. One fruit juice. I'm Happy Delight. One different flavor. Different size. You number 1 letter. Number from NG 150. And 250 ml.
Ebenye healthy life shows on your supermarket.
Happy Life Fruit Juice. Loaded with taste.
Emma wakumentu. Me joue for one who won't name. Who won't be
And me papa Mr. C.E. Chum. Me papa Chum ewo Kaneshi Presby. Papa Chum at 75. Oh papa, eradia ye be 75 years. Because susre radisa ne bambonya kese maw na nhwe so papa enya kese enkwatenten dia hodin wo mu ne yesre maw. Mr. C.E. Chum Kaneshi Presby papa Chum at 75. Papa Nyankopon hira wo no nya okese why happy birthday. Ene me nua Jeff Konadu ado. Ai Subruku. Subruku ose mayeye Subruku ya mautrin kwa mwa odapa. Yesi Nyankopon onka ho. Ommo ho ban. Onfefie ni bebre nka ho. Enkwatenten dia hodin wo mu ne yesre ede mawo. Happy birthday. And Mrs. Belinda Ochiribuli. Yes, we are headmistress. I was St. Joseph Catholic School. Yeah, war at Dabraka. David, yes, Salmani for two. And they were 4 year war despite media. Hase. When I'm so ton crama utrin kwamwa udapa Mrs. Belinda Ochiribuli. Happy birthday. Mian kasame Alberta, Mrs. Alberta Bossman enu kunu Albi. Me mamutrin kwa o achede fefe Nyankopon de achamo. Me mamutrin kwa mihrenya me emamo. Mabrabo ene ne hira kese ye ode aba bedom mo. Nyankopon hira mo de edi monim kwese adan so erade mamo ho ahoden na mutimi nye ne nyina na enye kama. Our birthday be occasion be anniversary be our celebrating. Yenu bom ede radia se ya kan se radi ye eti enjoy Nyankopon hira nyame adoma weekend di ana me lady di dina samwa ai aba father Kumase edition ebasom lady di baby ana ma wie bia minim se wa ye hyehye erade nka ho ate onye de aka ne nyina efema
oh Jesus yada wase na mafirawo mi bei nyakuku oduro shebe kumane nifa udia kokwa wani muai misi mempa bae mina nipo wachiri domwe sani onidi musa chinuo sana meni wachida mapo udi na mafirawo nibodofu nyakuku oduro shebe kumane nifa udia kokwa wani muai misi mempa bae mina nipo wachiri domwe sani amidi Joshua chinuo sana meni wachida mirinya wo mipa mirimpa wo ya makami utamse miya na mabuwa wo enti mempa bae mina mipa wachiri domwe sani
Lady Diane, Yatin Evangelist Diana Samwane, and out here, Dr. Davies Adeze, Ewo Yentem, Yene Dr. Ena Eba Betwaso War, Ye fertility and Komono Emu. Na, Mamma Dr. Kwaba, and ye Namimuswa Semtia once and ye think Komono say, Dr. Kwaba, Mebacha Bana, a Lucy to saying. Wouldn't say me there be a mebusa Lucy and son of my father busa Mary Lucy. Me hold me a bias, me jitum pass me a bias and so me fahum. It's Mary Lucy, so to say. Almost one year. Yeah, there are there see. It was for Dr. Davis Ades and Yanine Babedi and Gitahon and Ne. Obesima Nasha Hinu. Obesima perpetual Santi. Obesima baby I will be a winning sidoms for Mamunina heavy minim say the papa and bonemu Yankopon and count home Yankopon and count home meba. Okay, in terms of for me, the telephone lines no atumu na ya bobo biso dada ya share yen awo ehun sensem no ena ye beba be hwe treatment te bia hodo ya bobo oboso no ye beba be hwe ni treatment holistically na ansa na ye bedru ho no say ya keka bi ya ka infections de ya ka cysts ya ka menses wow any others enti so far Edian wasua. I think say ye shasia with ye nuanom a wo makra won ho no makra mo ho yia nanso infection bia to mo kwam o feel say won hia be menti won hyeda nhwe ho yie ebi nso a wo mo brabone nanso ware ye awo no emaye de yesua ne nyina megidi se eye ene ye be hwe ne treatment ho asem but before then no was special issues ni bi the abobo so no na ye calls 2-3 bi pe near the abeka doctor treatment plans a ye wono ho facility issues a yabro so dadan any de bi a ye nyan kan ye no 0302257900 opa membodi 0302257900 257901 0302 257900 257901 wa won sem no wa kone sen e de en wa ya fa ho still issues ni bia ye wie say ye mbie line ni biu de aka bia mo be friend doctor personal bia pese wo de to edwa na okay yes lines na ba ko noise we chirenti meme hu de ye papa no ti de friend ni bienu ni mu ba ko why de beto mama no yafa me fa de hin okay 0302257900 257901 0300257900 257901 why de be we chirenti the aye ne de ako still ye pause calls no na ye nko ye nim no send a message mumumra why aye ye hold on why we sure one hello yes Mira ma hi
Adiana
yo fertility nkomo yi o chefa wo mu
nkomo no conversation there but message nka chirimu yi chirimu no nshada and Thomas mu because that roma chirimu yi mai
okay mate enti akuza yam pause calls no de yam konkomo no so na mon send message mbra e bia no de mo beti ase yi why na ya fairfield because na ye treatment conditions ahodo na ya boboso to say infections to say hormonal to say menstruation ye dem crofon sem na ye mfato ho enkanka doc day one ye share omo matena omo eso yie on say ya ye nipa yi obi ana ne style of life ebi mu suban ene memasam ne abortion sam ne hwan but the warrior majority ni problem no ko the obetna say ye angro mpem by heart basabasa na wenya problems obekono na ebi hormonal ebi infections titiriwa esie won etimbase a say free infections treatment plan
infections that is more share akosho ba nase na infections. Hello. Yeah, infections not just say more akosho oba nase confirming infection. Well, you find that most Mpom Te Sen infections enter. Yeah, friend, Mpom Te Sen is silent. It just a sign be say a be a when your infection. Now so sign cry now a be discharge and also Nana Yaa say a yaw and I say be a period whom in some best. Now it is a baby as tibia mona obi wo hona utanya ana unya discharge bia esa ukona utu ho na montem na doctor anya ile nhwehwem because ebi wo ho na simple problem to say if you emphasize yeast candida and say keke
doctor say candida so to me
there be na pa say ebia na infection be anya problem
kese
candida nso hu sheda anya den wontimi hu say candida Candida maybe an infection from inside then after mixed infections. Until the one say Candida unquano, Abiana and Candida unqua be before from so and I'm more from so account. I bet me any problems abba. Into so bad here, who say when you discharge and your normal mawa, there's a 200 mona doctor and your because in print inside infections maybe silent crana it mean any problems ever. Prekwana wayasi shasi say yo ya ana woni hu kafo hia uti say eya wayasi ana se bia moja eba o period meyi na say ba and ba and na do say and next time say na in all aspects and then infection make me cause some symptoms here ebobo so ibintino na okonso anya say okoya na say okay all right when your infection antibiotics there be who say more people who at me echo share obasi man infections. I have friend PID and a pelvic inflammatory disease. Into the right thing say you be sample if you're bad sick. And never say a candida okay candida say common and then no far a war problems emma. Name will be say chlamydia, gonorrhea, other bacterial infections. You sample a bit me who say this particular infection and as I test no so say a draw away an antibiotic potting way and I was here then a treating infection no into infection the treatment no here pa the say infection when treat now be chronic like I say a check e ba na sia na chronic na fe no akokeka na awudi answer man anyoma they say tube say let me the tuber blockage eba ovary na be about two nkosi afa na nkasa so nya pelvic infection et me man nkosi ato nsem why then e cut down kra it infection it me say nyoma bebre
doc infections so na ebi hu nye hu ideally nyate infections na yaka antibiotics nanu na ye didi nkomo na yete so chese obi a wa abuse antibiotics kra no it me kokoye problem emma no e wo treatment or dey pa wo mu how
who say obi ho say o me just me say drain na me fire augmenting and I say ko amoxiclav and a ko no so work of there be it over for antibiotics sana say mo wan so o ma de o adapt you
Oma be used to.
Nti no so mo sesa. Nti next time we konom sa antibiotic na enye den. Emfa. And afi so no afi na what you say your friend resistance. Na mo wa no omo afi omo dane mo hu in a way say Ufa drubiana din se betimi a clear. Esan say wa abuse wa for antibiotics ahoro anase eyintine da obenya problem kesia e was maltreatment na fe nya antibiotic papa bia eden e betimi a clear mo no. Ukonye bi kura na burden din because normal ones no I resistant and be clear. Internal we can say antibiotic no. Ubakra na treat ya a targeted treatment. Yenim say when you infection, antibiotic be akeke. E was here cover certain types. I know certain problems. It is be treat pelvic inflammatory disease. Me am a gynecologist. I know say definitely let me cover chlamydia. Chlamydia infection be I know who problems. E be na no dey can share oba na say one man symptoms me any bacteria na say more fufura be kan ho a man mixed infection. Into what treat and out treat just be a normal antibiotic. Now one cover chlamydia infection and then more adding at a honor at the damage by and so I am more bad and I see any bibians now cause damage. I wanna say.
It's to the ordinary woman or tip pain beer and also funny discharge beer now or red and yellow no M1
Pacho wrong practice and this will be the problems about
infections must be treated by a professional.
By professionals. Targeted. And so the treatment must be targeted. And also the patient say, you're treated blindly. Oh, okay. Broad spectrum antibiotics. No. You're targeted specifics. And so who treat it, send by a dachi or bad in your day. On your side, our home problems. Yeah.
Doc, yeah, and only your infections.
Yeah.
Okay, so you move it to hormonal.
Hormonal, yeah.
If you're on my by no fault of mine.
Yeah.
Last week, ya kaya babe see ECP na mete. Men person me bubo audios, but oma me no mudin komo no. It's a Monday cry discuss the entire ancestor or risky or life on ECPs. Mene mma be breeding komo a omo hormonal imbalance omo call fertility clinic no the doctor kai ko hune guy near say or hormonal imbalance or hormonal imbalance a big can confess to ECPs say or no she was on ECP for a long time utmifa ECP between 6 to 10 times in a month. Inti or the problem na show hormonal a man made any the a natural to say be or PCOS treatment mode.
Yes, so be a hormonal problem and it is any hormones no balance. Yes, it was a checking hormones no. On say hormones so the balance no it was certain on say ratio be or say hormone way anyway a balance in a way. Na say hormonal problem ba na say this imbalance na ba and I say hormones no and she balance ye. And hormones so any period and so period e be ya most likely say hormones be balance. But be so when the period the fine so na the hormones balance. Into hormones periods nkusuato and intertwined. What I say boom e ma bibia e fine. Yes, into hormonal imbalance treatment. First of all, now was here nientia only a hormonal imbalance. Now teach you commonly PCOS you from polycystic ovarian condition and as a polycystic ovaries. If you from polycystic ovaries or polycystic ovarian syndrome. What it means it means problems are overall apart from hormonal imbalance.
Okay.
In Tisabasana, then treatment should be targeted towards the hormonal polycystic ovaries. No? Now, polycystic ovaries, I mean, also a whole treatment now. It's going to be a whole range of topic because a whole topic on its own. But Nitia, what I say, hormones, imbalance, a problem, a being no. Into Chaska now, who as a space is getting one ovaries or polycystic ovaries. Now, a bit feels polycystic yet me free ovary no any possible name woman treatment a bit me my hormones na air and ebe balance but ovary no will still remain polycystic but say hormones no be ebe balance into your treatment overall na I don't see a treat here. First of all, your friend insulin resistance. So polycystic ovary me might be no more sugars than any stable. If you don't crack me from diabetes. Internet was say insulin resistance your target and no treatment. Not just no bit me a correct insulin resistance should be point number 1. Addressing polycystic ovaries. Now, point number 2. Maybe I can so be on period keke first of all, let's find out say obano dear no pe. So obanya polycystic ovaries not say affecting in any way on power near year. Perhaps the yes say who ya baby for that moment. But what I say. If you are now about on any period in 2-3 months and son we say any period or no so on power. That is not a big issue. It should be targeted towards only symptoms. If you know so when you have hormonal imbalance, and you want to people but weight problems, then you look at that. If you know so when you have hormonal imbalance, now any pimples, breaks, breaking hormonal imbalance to me causes if you are not any problem, then you say so target treatment. You get it. But ultimately, say base award. Then we look at award now insulin resistance. What tackle no in pre-punit we correct most of the other symptoms are hormonal imbalance. Emma, because I only insulin resistance now. Insulin hormone be regulate your sugar your body. What is diabetes? Insulin yes, our insulin now say and I say hormones into that insulin and insulin into that hormones problem about they have to break that chain and only your treatment and so with the break is chain. Now ultimately upesa ovary no is there is correct from cellular medicine the treat polycystic ovaries stem cells the ultimate treatment and we rectified the imbalance ovary no a basa problem ovary no am thickened resistant to other hormones near polycystic ovaries let me reverse this syndrome in the ovaries near you fine.
Doc, there is obia in the share way fidi crasso due to PCOS.
Yeah.
Na opeba o say yenya targeted treatment.
Yes.
Se nipa ne mpeba me onko ye eno ho treatment ebe ha no. But in this case opeba ye linking it to fertility
yes.
But the other aspects in abeto nchen. PCOS treatment if not by cellular medicine and even if by cellular medicine ebetimi amamenya BP.
Well yes, PCOS bet me ama obienya weight problems. Now weight problems is say or gaining weight or you can say or you know air bros no bet me for manya blood pressure issues. Okay. So also na bet me am so anya diabetes. Insulin resistance ya bobo into yes into bet me am obienya BP yeah.
So the PCOS na keke no ebetimi amonya BP ebetimi amonya diabetes.
Yeah.
Because the ene discussing the condition wa ha. Ewiase no na wanya spondylosis. Wanya BP. Or the BP treatment is so diabetes treatment is so and etoda on nante free ha e dia for steps cry. There will be 1 minute and 5 minutes.
Yeah.
In situations like that, a quite cellular medicine betting me for
right. A person, me sure such a patient, if you are now or weight issues and so need weight issues cry now. First, you encourage on exercise, weight management, or managing the weight, exercise, diet. Are very crucial. That's step 1. Lifestyle changes. Step 2. You need to treatment as well. Then step 3, cellular medicine. with all these measures, the cellular medicine, not just say you harvest stem cells now, you inject your ovaries, because you say ovaries and then you to baby or two because you are a problem no internet say you target you on stem cells, cellular treatment, your ovaries, no, I'm ovaries now, yeah.
Doctor to say sad diabetes ne nuanom sam ne to nchen na you say for whatever reason diet na you maintain certain weight way na any treatment na fe fa cellular medicine no MP or so only kono naturally ebetimi a correct the system na the system betimi a correct naturally ama through natural means, not the other assisted means with me conceive na.
Yeah. Aha, me kaisa me do lady be a program. I'm some no krana. Yeah, no I want 11 years. Wakoye I unkai lady.
Ekaipa
wakoye
IVF. O say yeah ka say or not America test me.
IUI, IVF. Then one year. Oba na me diagnose polycystic ovaries. And I say look, koye exercise. Na reduce weight. 3 months. No aba. 3 months pepe no nyimo ye. After what go through IVF need there anye because one just anye me ya look who koye IVF krana if the ovaries are not just a polycystic because you are not there and you're strong. Also be a polycystic ovaries near say the donor egg and a hearing. Man, you know onye. No, it's not, it shouldn't be. Definitely so to me young because you're free such a person.
Me wadanphobia no because pen adwumenti no Kenya or Ghanaian and now okoye assisted ultimately koya almost 5 months but oluzie for 2 times we can wait management ehona ne remedies started improvement back home in Ghana and now the conceive when you 2 kids
naturally
naturally
yes
and also so 1 year assisted okay so doc ye ma ye ma nti me kono the average margin kakra weight loss and shada en yama say shape gain weight loss in general and shada en yama pi say shape gain and the average man doesn't care how obenya the contour as ope but weight it's any way and what advice and I would ma was direction so that the one a 25 26 30 35 onya obewo but or use certain garments certain medications and they be social media and say because we capsules and ni nuanom in ya dream to have shape and that stuff no and infertility.
What's the last people me can say yet me nipa ni body fat every shape form into me fat every ni yam say every shape on the hips and the nim nsa you can use that. Anyway, just say you are shifting fat from one place to the other. But practice now you can where or barbecues or fed drona what put you on weight. Where did well marketing no say or no ma everybody to aba everybody no for aba. To be honest, any drone is not doing that. It makes you eat. Everybody the food is excess calories, no. Converted to fat. Fat into the deposit baby. Ebini we yam or hips or no for this. Into not per se, no. Any drone it's just an appetite stimulant. And stimulate to appetite just to eat. And no fat in the deposit. Now, Sandra, you don't, and not even well, you don't even know what they contain and a long-term effects and so. What I was saying, chemical it dry chemicals in the first place. Now a core body and all that in the ejuma ancestor na kokao and so internal say Nancy was a man in late 20s, early 30s. Now I am right.
And
some of these practices, yes. And
stimulants bebrebe na.
Yes. Yes. Into advice I man say in immediate term because say bia when you open and I say aboa but in the long term afi we do baby open ba na afi a problem. Into any habit was discourage mama anya kra.
Doc, a man being so say contraceptives in general effects when you are ready for reproduction and I say so be conceiving. Remember ECP as ordinary, but contraceptives in general.
No, because contraceptive there's one thing about medicine. Answer because it will be safe. Not just say I own research. You say okay, say draw a contraceptive. Not just say yeah friend and not just say permanent. Uja do now I say I want to situation is now reverted to normal. Into a lot of research aqua contraceptives. But in principle, by within 6 months a year, na system right I rectify. Into sad notion say contraception. We share the benefit of contraception against say short-term risk. And a short-term risk, say a best no, because research suppressive would then it's not fit enough to be a contraceptive because necessarily effects in your desire appropriate and right. Into people should disabuse their mind contraceptive to prevent pregnancy. When you are ready and you stop it, your system must revert to normal. But there's one thing you say, you are 25 and I will start a contraceptive. If you are for 10 years. And then so about what would you airing? So eggs, unkus your tone air coffin. Until we are 25, I will start a contraceptive. After we be 35, we age 35, I expect this our body a better function a brand now we are 25. Into which contraception, I would say I want to do contraceptive. No, it's because body clock nankasa stage I don't know. No. Yeah.
And only the general contraceptive.
Yes, the general contraceptive.
Okay, the abuse of ECP.
So about how we hear emergency contraception more than once a month. Not just say you don't need emergency, so you're permanent contraceptive. As I said. Hormones, we say hormones. IVF, we monitor hormones on a daily basis because that's the way the human body is. Me check hormones now, and the same. In the menstrual cycle, until we could far extra external hormones be able to share body interfering with hormones here already on a daily basis. As I say, at my system, no confused. Now, feeling period when say homogen mojaba hormones and she balance. No, into the emergency. But we need it more than once in a month. You better we permanent contraceptive more. Better. And you was a contraceptive and so permanent. Sorry, not permanent. If I just say contraceptive, permanent, they just say no reversible type. But just long-term contraception. Long-term, let's just say. You come off the contraceptive and then everything.
It be as a man feel say the average pill, contraceptive pill, a year per cycle be at 28 days. I'll be fun daily whether or be have an affair or not. A nuisance, a man, and then the rebate means so effie. Somewhere along the line, into not when to me I'm funny holistically. Into why not use ECP after act? Now what they using it be 4 times in a month, it be 6 times in the month. Be will be on one catch at least 10 times within the month I used it. Doctor, who two for long-term usage and the daily intake as against emergency but constant intake per science. I didn't know the bit for.
Yes, our question I will be say very important because yakase for emergency, you know, in a cycle, for emergency contraceptive, you know, 2, 3, 4, 5, whatever number of times. Hormones, hormonal imbalance. Then after the year encourages say they be for external hormone for long term. Not just they be for and as the baby they be a releasing hormone a cell system. Well, sir, the contraceptive now long term of if the piano. What it does, and say one cause hormones, I push your hormones not to change. Into a suppressive ovaries and hormones. Into say I take you over all hormones. Into be hormonal imbalance plan. Yet me the contraceptive pill then treating hormonal imbalance. As I say, no a piano system no change. Not suppressing, not take you over. Now mouse are regular hormonal na must be very smooth. Into yes, into so babinum contraceptive debiano. So what him say Abia won't kai na because I said they at the same time won't kai who setting alarm cry and there are other options. The boy na pani bin about every bosom and so fine. And I said nearly share and say and also 5 years, 10 years then and also fine. If you walk around the share about now would you kasa emu and also no fine.
It's when Onipa Kroko share now feel say on your comfortable. The skills women have with long-term contraceptives. Or feel so me share we no me comfortable. Me hu we my basti, my me gain weight, yeah. My say me pimples and we always find a reason. Say I was hard to be anwa. As doctor obo ma a epa ema omo e dey futu na de my.
Well, and as a home specialist now you have alternative because oral just hormone de bia no kra no your types it is our weight gain your particular type and my weight gain send a formulation it and my weight gain so acne and as pimples whatever my internal it with me change you to another form of oral contraceptive, so oral and our power. And into your choices, options into at least say 3 months a day. So also if you are wait issue. So 3 months a day, yet me you want and also kitu ebi na share wombunum. It's a coil, but hormones and also. And you say a month's hormonal effect, call system no be brave mouse our weight gain issues. Into whom doctor, I hear something about it. Options because a new biana with me use the same type of contraceptive. Neyama obi no enyama obi. Into sir no doctor I discuss no your situation and circumstances no baby.
Do I talk to GP or a gynae specialist? I'm saying so because yakoko jina pharmacy. Minum way me say at most na wako midwifery desk. Now wakwako complaining. Is this enough?
At all. And enough. Say who be only well about contraceptive because we are say a clinical dedicated for contraception. And then nurses can because they can be trained to man such a clinic. A contraceptive clinic. I be necessarily say specialists and a doctor, even nurses. In terms of the training, and the most important thing, if the people are trained, and almost training, so they will know when to refer. So, okay, who is a home specialist, and now another this category of doctor.
Okay. For Dr. Davis Nadine Komo, a day a far yen challenges a hot one, yabobo biso, ya hair infection kakra, ya hair PCOS and so kakra, and ye focus no a treatment plans ɛwɔ hɔ ɛma obi a ɔpa wo nti yɛbɔ bi so a na doctor hwɛ how best a yɛbɛtumi use ɛsan sɛ doctor yɛ Dr. Davis yɛ obstetrician gynecologist and ɔyɛ practicing cellular medicine doctor and then as a bia yen sub-region ha yenya a bia ka ho fine but the last time I checked now ɔyɛ Ghana's only and then your sub-region no yen only cellular medicine practitioner and yeah share all angles because as a gynae on my reproductive health men can to me ho referrals say referrals 100 assuming 100 in a year to him at least 85 it me conceive in a year per whatever the knowledge means or using it works and or ye ma ho adwuma now cellular medicine abeka ho so you be see kanemi no bom na ye de hwe wo haw no ehum waye eti mo na me busa how far na mo nhye dante ase no probably we are why ni yi amamate doc assuming say infections ahame ovaries assuming say cyst ahame me our organs no ebi assuming say bi pete say tubal blockage ni nuanom sa yen problems 1001 fa we ho me fa the in quote decent women oni obema bia nkwada by heart nti na nemo keka no a ofa ne se ebi a chlamydia ebi a normal white o dey say ye hwe bibia white normal white onya capsules binom ana otenansuo bi so ebi okra onye hwe ne immune system betimi ama onya reaction no ebium ofa ne se ko 5-10 years after ni abehu se eye infection abetna system no mu yabehu se cyst bi ene wo baabi yabehu se whatever the problems are yabo boss ni bi se or the cellular medicine ebe hwehwe ne treatment or start saying
right. First of all, I will say problem cranya back. Okay. Your friend say infection ya can asemi. You suspect say infection. In principle, scan which crown on your then say be infection as once a while ubehu bibi. But in terms say who suspect na say war now suspect say e be a bit me infection. I be na all kind of tuber. Now I was here first of all you're checking the organs. The state of the organs. Now scan and be mind all that information. Scan the back show so organ no would look right. I just say ni senior no okay, but end being try say senior see ya jumani okay. And scan is for looking at the organ. Now, after that, so check is that organ is it functioning? So now, another hormonal test. If you say ovaries, unkosia to okay. Unkosia, let me check it with the blood test. And we say unkosia and do quality at the sign. Let me check it with tubes. What is it? We say HSG, hysterosalpingogram, the X-rays, and a scan. And then should be a fat now. I say. I check if it's a tube, no blockage, woman, not blockage anymore. With all this, no, I establish it. I told you, be crying more important, effectively crying, be friend laparoscopy near the camera. I found that nefruma, Ashe, I say, Ashe, and what there's infection, maybe be our would you any camera no any a behum.
It said the normal investigations I call hospital doctor see and we be na work on
right, we're next level. It is why a normal ones, problem no. And I say be a one ye. Now so we laparoscopy because then there's so anesthesia near the camera. Efa from an assay. Yeah, I say. And what would you know organs? All the reproductive organs, any infection, old infection, active, then other conditions, endometriosis, mojefimbi nasia friend endometriosis with a camera on it,
everything within the body, within the reproductive health.
Into laparoscopy. Into now, then what planning? Cellular medicine. Now, laparoscopy, no, at that point now, no, you beat me a cellular medicine, I'm only across straight away. Say organs ni bi na akeka bom my friend adhesions. Yet me a breaky it trust adhesions akeka organs ni bom. Point 1. Number 2. Now for the cellular medicine ankasa ai den aka organ no. Say the ovaries ni nkosi at all. Ni ya cellular medicine e dia inject ego ovaries no. Number 3. Say a tube, na say tubal factor, na say enya with a laparoscopy it me enya you bit me then eddy a tube no eddy cellular treatment aka tube no inside emu amana okay next be na in the program now fibroid polycystic ovaries tubal blockage the stem cell cellular medicine yes
our planning IVF awenya
yes exactly onyimo your way program into stem, that's the power of stem cells.
Okay.
So, and I said cellular medicine. Because cellular medicine, you use stem cells. Stem cells are cellular medicine.
Sure.
Yeah. Into depending on the problem. And you see, internet just said, now, would you ankasa, the tube, the ovaries, yet me the cellular medicine, SCC, all this. And so, now, wakwaya IVF so yenya ninkusia or polycystic ovaries yenya ninkusia no with cellular medicine is very possible it may rejuvenate organs in nama if you so obenyum so nyin sara den asay onyima na say enye so ntimi nyimo nyin sara ba all right e be do some stage and I say early stages kra na den asam be sing eno e ba sa na e bia ninkusia to na ayeden emre say embryo na say baby no form na enya stronger embryo no nya stronger a bit me this problem ya but na if you want say mprempi no who compare sperm any oba maybe sperm any oba nkusia na say most of the time weakness say emuba ku ye weaker is the egg rather than the sperm and you know yet me rejuvenate ovaries ma eggs near quality quality embryo no so and I say baby you never form no so be quality the chance say vagina no fine e be so ho na wudi na kasa emu no sa infections ya boboso yi enye say ta na ya sinko o na wudi ni emu inside the womb now it say cobwebs what is that
and
tintai ehye na wudi no emu esa infection ya ka yinti o. And I say, "Yo, are you operation be pen and I affect a honso." Yet me the cellular and stem cells no, SCC na would no immunity because IVF embryos when your embryos do a sign you see quality near good and so we share woman no ma fat na implantation problem na would no immuno and you're right. And yet me the camera na would no hysteroscopy. Na sa in time na we share no ya you breaking nyina and so a bit me aside for mobium into rejuvenation you know at the very time now just rejuvenation so account into endometrial rejuvenation send the chance say Emory University and I be implanting very high and as a miscarriages say very high. Okay. The cellular medicine and improve chances of pregnancy. By more than 85%,
Doc, ya ka say ya no be test me. On some phone so sa no can say. Ono as a person or back na we through the initial pregnancy na was so ye resource. na yema no short one assess it when your opportunity to know and assess later wa miscarry 4 onyem but ontumi and sustain pregnancy no ne guy ni say a year because of ne previous episodes. Is it possible?
Right, but I was the episode no was again.
But even though who say or resource
okay, okay,
issues,
yeah,
one just short,
yeah,
until afterwards now all miscarry no. Ne guy ni dia share the miscarriage no a share resource no. Now person who say is it possible? That's number 1. And number 2, if a yenwa she's still in her 30s, can cellular medicine help remedy the situation?
Right. First of all, over here assessment. Your friend be antibodies. So antibodies nervous system from previous awono. Ama baby no ni moja ne bi ewura my obano and asa ni mami system no. Ni mami so mount antibodies. Into antibodies no the system no. Into the first and foremost say one, I was here then you check say antibody no level bank and a warning system no. Ebi na was even so hard that much. Now, an immune problem. Now, stem cells into the center of our immune system. TSOB immune system and immune system. I say, and as a boost the immune system, it's all about your stem cells. Into your stem cell procedure and you're intravenous. Yeah, the fat drip mo.
To say we kwaje drip
yes. Into a modulating where your immune system. Into the chances say, ubesanya sa a resource problem no less. Meant to make say 100%, but much less because your body will become more immune competent. Yes, because immune system now is modulated, enhanced. Yes, and the stem cell can do.
Now, doc, antibodies no naturally ain't mean free ho.
They've been preparing antibodies because body not mounting to for life.
For life is the same.
Because once an emoji what the system need there. Open say you be antibodies say your friend just say so we need emoji that one will be emoji for but still kakra be what system no. But we are this immune what do you call it stem cell procedure now. Yeah.
The antibodies no was true me about say ampa say and they cause miscarriage.
Yes, antibodies no was true. A bit me about say and they cause me a resource system incompatibility and I say yes a basa na a bubu but baby say basa na say baby no tio baby ni blood group positive or be affected but so a negative antibody need to be affected no nti so obani nyuma yet me twene moja na nsen kura ehun baby ni blood group nti the blood group na say negative the chances of being affected no less. And that's point number 1 to reduce to know the baby's blood group. But stem cell ankasa there we use it intravenously before so benyim.
Amazing. Doc just a doc you share that share sa minim said a dorsum.
Yeah.
But just a share that per time. Na couples who said you share sickling. No me gidi say share that aspect and so in a way a bit me aboama yet some of the stressor related to miscarriage.
And just checking of blood group. They checking blood group new year and sana because obey affected no so or no obey affected so no so a resource negative. Into that's point number 1. 2 into so be a resource positive and you like resolving issues
negative for no problem.
Yeah, but ebi so why be na ya man moja pain obi antibodies be akọ ama ono so the body am reacting to the only acron moja and also the antibodies floating or system no and so is another mechanism.
Okay, doc, still on cellular medicine and correcting damages. Nano minya ectopic. Inti per medical procedure ye me lie back. Is there a way a basa oya kuno se nyin se ho asem foforo bia I am share as to say kusuano ebe formulate we hene na akohene the risk factor high. Dear when you ectopic for that no reason treatment mode be wo ho na emano under CM cellular medicine.
When you're ectopic, if you know why you operation, no money tube back. But Nancy ectopic means so some empire na just can test a whole route. It mean mamujama ectopic dissolve. Okay, dissolve. On your operation.
How fast? It's any paninya. Sign of ectopic now. Yes. How fast now doctors timi buano make a duration or the bedroom facility and the right facility because referral system there.
And ectopic be an emergency. Will be a friend unruptured ectopic, cold ectopic will be we're missing the period or about which scan me was a baby baby and I said need now we have hormonal test this one say okay sir ectopic. So I know you have cold ectopic. I just say hot there will be why rupture and it will bleed internally. No. And you say you just can now near taking measurement of the ectopic. Now for the hormone levels. You just say mujan sembia mbana embetana ya senior. Yet me my injections emma a dissolve. And just a dissolve prequa but you over monitor over a period of time now hormones no back down. Now ectopic so echo na body with stem cells ebe clear ectopic finally from the tube.
So still that's all. Okay.
And you say say obi anya sa any pain. Na say the other tube no juma u test it, u check it na tube back no juma. And here so be anything different. So we lose the tube back cry. You see Nyankopon boy said that say organ be a tube and back you expect. And to lose tube back that's a perfect a fire. You don't have a problem. Men can say okay, young can say two lose back the chances swati by 50% because half of 100 50 back when say 50% chance there be more than 70% chance with one tube if it's working well. And egg bit me free maybe a tube back na any hokra in the ovary egg bit me free the other tube na saying into your chances are still very good. Into that you don't need stem cells. But the bakuna kind of problem or whatever. Yes, then what it means the stem cells because you be able to afford IVF. Into stem cells it means the be tube
Maminya naive kakrawa ha. Without tube there is no conception and if I don't have tubes, can't I conceive?
No, sir, tube in you can't conceive because tube no a hona nkusiano or banning kusiani bear man sperm needing is here. And this who's a tube in such our would know who's a blockage about and a bear man sperm no so free or badasi a fan I would know nakoshi a cotubunum. It is a blockage or and me tubunum. Emani and sent me kusiano emani. It is a tube anywhere. Yen sent me and happen.
It's me happen naturally.
Naturally, yeah. Sorry.
It's about I just say assisted.
This assisted. Near bibia so process now I was say it take place when the moon on the tube on the moon outside. Into na bonten na you try banning kusia any sperm no instead of say as said tube no anyone into no near the dish chance kitwe mu na e fra na pikia near the befa obana si near the shana wudi no
assisted.
The tube no very crucial. Very.
Meaning say organs are Yankopon boma ye ni nyina Bia is for a purpose.
Yeah.
It is say you may bia ho ba asem if possible.
If possible, yeah.
But if anya possible na asem ba, we must work on it irrespective.
Yeah.
Doc, natural means of getting pregnant. Or baby nyaya enkete saa. Just a bia omo nyom ho part say international celebrities or feel say or no go through the process of carrying a baby and one 10 year on seeking the services of surrogacy. And yes, I can natural means of getting pregnant, delivering and je. If by whatever reason,
Yeah.
meant to me through natural means. Now me say, still I want to have a baby of my own, if possible, my ex. Procedure are available in Ghana currently.
Okay, Nitia 1F and IVF and as in vitro fertilization. I want Casano Yankupon, you know, into was a Yankupon, so
I was say you're thrown near soon,
yes, because we are IVF steps I say will come through and to say maybe about 20. Every single minute step. But Sebastia naturally that's a and to me and happy now. Then yes, we do our possible best. One, I will say finding out Nintia and Yaden and happen. Okay, one, you can't tube who say me, but say tube are fine IVF. But IVF also doesn't guarantee say chinchana and that's 100% a bedding. It may happen. That be
me home crop for a IVF 3.
Oh, 3 pay. Bolivia 15.
Ah?
Yes. Ghana has more than 10.
Wafa process.
Yes.
Tari wemu.
Yes.
15.
Well, yes. Easy. Right. Into yes, not just I don't know IVF because naturally, you know, you say a bad ding, and sometimes you can say, well, the chances are extremely low. Into I don't know. You just say we tried to boost the various stages. Never. One. Also about you know, on any period or two one every month under normal circumstances. But IVF just say amount do say na be ya nkusiano ebe doso ebe develop ebe hihye amana doso. They atwitwe san nkusia yi e dey afra be man sperm a fertilizer ya she obana na say. Into where natural means and then IVF no then we're trying to do everything, you know, say ebe embryo no dey show obana with the animal. Now and also because some kind of stages no be o hara nkusia to also an issue. Nti hona e kan say e betimi use stem cells amma obi o hara nkusia fem crab, but we can, you know, boost or rejuvenate the ovaries, from ovarian rejuvenation anya ono nkusia ede now would you also say more and that's implantation and take place and me and the baby in shakrana and me and stick and you know yet me boost it now would you so more endometrial rejuvenation and also adding and there are various other things it me a more chances of course but 100% chance
and doc to say omo womb issues.
Yeah.
Enunti per whatever the issue is. On when to mean carry pregnancy no naturally. Just say assisted. A bit more due to that a bit more opt for surrogacy.
Yeah, sure.
Currently in Ghana, many sure say shed that war. Emra and there elsewhere it is done very nice.
Yeah.
But yen ya no enti nipa cross okay make kwakoye surrogacy the fear of no because emra enhye dam be bata ho emma wonye confident inti there are others careers no or gene sika all right a career pregnancy no all right wo attack medical practitioner wo assist ye no gidi out of whatever wo de yemfa emma no na onko blackmail enti ukacho be say okay there is an option called surrogacy try was no because of nano sa asem winti o say womb na ewo issues no ana issue no ebi o ho a yetimi de cellular medicine correct those issues no emma womb na nanka ideally previously intimi carry baby no now capable say be carry baby.
Yes, possible, but then you also the type of problem
a woman.
Now woman don't say woman over it is a pair and a line who's a pair baby we a free man sa in a tarimono a woman in the line any endometrium no in print you know say woman you okay but sa line in your right and you okay ibo hane mo katakra so it depending on the problem and the extent of the problem yet me the stem cells and cellular ema womb no
is it
but
expensive?
Of course, we have an individual basis. Obi had any problem, but yeah, assessment that's very possible. Yes.
Probably they may king kind of me busao no a people and crofo enlarge ovaries.
Yeah.
Yeah, won't be money ye. Ana.
Okay. It depends on the correct man enlarged. In principle, polycystic ovaries, ovaries, enlarged, and also ovarian cyst. It is there are things that we can. A bit may be because polycystic ovaries, I mean, a big deal to be honest. A big deal, but depending on how managed.
As a big deal, cellular medicine the one is a big deal.
Correct.
But for other treatment methods, it's a big deal, doc.
Big deal, yes, exactly. But well, the way I as a corner, is what I say, yes. Because in Mobias, IVF 6 times. Polycystic ovaries. Them be quality when this. With cellular medicine, with many good quality embryos, and I get my point. Into cellular medicine, transform the management of not just fertility, but to say you can't fertility was but yes, it's transforming, including a member side, because at the end of the day, cells now are healing. Baby trials is here. Ekroni mi boa. Stem cells. It is cells eat me ma ekroni ewu ebra when ya ekroni hwe krana. Ya fa so hospital ya say pump ya the plaster spirit. Ni nyina say na be ya mwa wa nyene enkum. Enye na be ma ekroni hobe ebe healing. So skin hunam ne be eka abom healing. Na ya stem cells na. It is what me treat stem cells ya to me repair damaged skin. Now the share organ be more. So organ is just down and damage is just down. Can't it bring it back? That's a simple analogy.
No, cancer me kwakotun krabano. Issues related to conception. Delicate.
Yeah.
It's emotional.
Very.
It's very, very expensive in some homes, but it be more funny free. To the young lady otie ye ene factors aye bobo ene de yam bobo a ebetimi aha no na no nti was take precautions ene sometimes so hwe de man crofo memene crofo de hihye for lack of knowledge a harding advise sa emano and then advise the elderly. No one also emwa with direction because it is obi a owo PCOS. Pa say e be a parents enim sa me ba a condition near, you can advise appropriately at the right time. Sabi you be taking some precautions and na oba conceive. Is a say ni nkoso ya be wenia ko form akosi ansa e na wastata ye ho bibi obi on na period na makeke no e ne de ma me ne so nka ho hwe onim se da acho no aso be gina koti asu e na wo mame please advise na yenkoto kramra.
Right, we started from younger ones. Infections here, you say it means organ, reproductive organ, be very important. One, indiscriminate sex, and unprotected sex. Unprotected, it is a raw, and bounce with the nasi excuse me to say a receptacle. Whatever goes in there is received. If there is bacteria, whatever organism be a woman, na cause damage. But protection or use condom. Sperm because the sperm they carry that's it. At the end of the day, I know because sperm there was a I say motility. They acquire a fan I wouldn't the vagina now in the cervix now would not got tube now got tana assay. That's how it is. The sperm no will carry this. And you know what my chance sperm say acquire. That's it. Then a barrier, contraception, condoms. Now abortions, and prevent the pregnancy, into contraception, and it's very important. Yeah, but also, like I say, any emergency every month be our emergency. Now, if a contraception, a long term. So until so you are ready. Until officer want to me, the first thing is to abstain, of course. Want to me abstain, then precautions. Yeah, you I said this. And I think so your body exercise kakra we period assistant for check up be an problem binti. 2 when you discharge kakra my ass ya me kakra visa condom my so and whatever it is now after the one who's at all and I don't know be an infection been when you datching the problems adding ebeba. Now, about who do stage B, if I say around 30s, more late 20s, air corner, fertility check up there in here because when you check up, who feels our body be fine. Checkups in here. Our recruitment warrior, so we have fertility check. Yes, you call your blood group, call your HIV, call your this, as a fertility check and so then. But it's a problem you will cry now. Then we know say we can. Pajon. They said me what 20 just 2 weeks ago 23-year-old girl I was episode donating in Kusia MOB. You check here I don't know in Kusia I don't say be here 40 years. She's only 23.
Amazing.
Yeah.
Amazing.
Yes.
Because you know what from.
Could
I dream person could be donated be a movie.
I will. So what am man advice? So into we want check here. Who feels that we are young and I to be fine. Into checkups here.
Meton Kraba. Maybe.
Said you bet me a check in a farmer APC in Sunti and why yen sakuma.
Uti paiwa.
Fakina farmer akuma APC.
Kaka hawa.
Akuma APC.
Sisiarie. Waposunu no mpemu na ya oya. Fever anawona miya.
Emubia kina farmer akuma APC ebeye firi ho. Nemum nanu achi na enkoi dia kuhu doctor kina farmer akuma APC eyema obia ya wadi emfie dunsia 16 years dekro.
happy delightful Jew. Wachilala, swachilala, chichi soso. Afrana pa. Pashu breakfast and was in woman. Joe happy delightful juice against with toast, cereal, and even them cool. And we ain't bread and fifi. Most fridge man. Happy delightful juice. One of what? And you be here. Come here to relax anyway. So I know when you're. Let's say what the chamber. Happy delight free juice. Offer a baby I bring you all day long. On free juice. I'm happy delight. One different flavors, different size. You number 1 liter. Number from NG 150 and 250 ml.
A baby will healthy life shows on your supermarket.
Happy delight free juice. Loaded with taste.
Me da say, doc, aka parents no, edi eni Mpom. Say obatan emwa obetime di aboa ne ba whilst ne baba onyini ena problems are your fan of Quemono, it's me prevented.
Yeah, first of all, as a once I started say on the period no. A while as a advice about one life, sexual health, say the body. No, it's a big step and a change. I want to brab in life. At that point, say, education very important. Say the body. This is how it's going to function now for the rest of the life, and this is what it means. This education is very important. Now, me sure say before then, now okay, this about your sexual healthy. So on your basa. A do stage now just say bia after despite never Kenya still and what in China no can contraception and some sexually transmitted infections. So in a school curriculum so should be addressing some of these because by the way whatever it is nobody some stage be definitely they will know. Into somebody muna almost worse than say at least somebody man then they know what to expect, that is and how to go about with life. Now then the next thing, keep an eye on your cycle. Obadi is about a cycle. We were patient now, but now maybe so menstrual cycle. That's it. I'm able to get that history. More than 70% of the time, meaning problem no grand sign away then. What can I say? Until baby and keep an eye on. And then we talked about abortion, and so you have to advise your child about it because of society at me heading.
My imagine say measure their treaty abortion.
Yes.
Yama abortion. Aye paying loss. Any ye moral status. Na bonia de ye no kwambone so no eti now I'm beginning to feel say why say yen discuss it the good, the bad and the ugly. Yeah. Now obi ntimi make a choice. Yeah. And you would choose see the bad na e ya wasem unya uskana unya usikana ubetimi ya assisted procedure de awo over to you. But when na one say one why your bone enkrofo e hye suma say until recently ne encheche quack doctor see okofa two ba ko mienu bia and girls ya de niema e hye chese problems bebre ebe wi ase no na ba be ye sun ye discuss fertility bia ye emotional na ba be your how
yeah
doc ye dase
yo so that's anything for you nas
yo I was on for we Dr. Davis Adeze wo ye obstetrician gynecologist or ye sub-Saharan Africa cellular medicine practitioner. Issues of fertility problems are a by treatment methods available. You be di home come. Ebia now question. Ebia now ye ntimi phone line see ebia no na emwaye papa. 0243 fapen ne patrol number no patrol 0243 67 85 26 0243 67 85 26 the episode if treatment plans or methods available what who status what we know dear now what emma aye like obre time on so we your bar take sa time take na jawa yebhihye no kwa ho anya bp o questions beboa me bia wanya solution 0243 67 85 26 0243 67 85 26 that's it. Dr. Davis Adeze ne ne babedi nkumo odi anka kwa me boa kila bobonua ene ye dane baton no e de ama no me da se oti ye abuso fam chwa me mo ye ho na nyam boa next week e china na wotwe ene ye nua mam biama kwafo ye pene ma me crap bere na ye gina so aye ne yi e wa samantam foi ye bom nka ye se brena so e next week ochina na wotwe iti enya ahoboa no ne yetimi akoboa no amana ye fe midin Nana Yaa Konadu Christ ama ebe shi ajwada midin ya mejamo